Hi, my name is Greg Fell. I'm Director of Public Health in Sheffield, and this is a brief synopsis of what the four Chief Medical Officers said about the benefits for children returning to schools in a couple of weeks' time. I guess it's important to read the Chief Medical Officer's whole statement, and that's on the website. And we'll put the website below the frame now. The current pandemic means there are no risk-free options here. It's important that parents and teachers understand the balance of risk to achieve the best course of action they possibly can. We know from multiple sources of evidence that a lack of schooling increases inequalities and reduces the life chances of children and can exacerbate existing mental and physical health issues, and that's really clear from lots and lots of different sources of evidence. And that won't be possible to address that through homeschooling alone. Hence the CMOs are really clear that getting back to school is the best option. We know that there's extensive evidence from a range of international studies that the risk of death to children is vanishingly small. The cited numbers are one death in 14 million infections. That's very, very small, much lower risk of death than for most seasonal flu years. So we're confident that there's a very low rate of severe disease in children of primary and secondary school age. The percentage of people who have this illness that require hospitalisation is 0.1% for children aged 0 to 9, 0.3% for children aged 10 to 19, compared to 4% for adults. All up, we're very, very sure from evidence that children have a lower risk of catching COVID-19, much lower risk of hospitalisation and severe disease, and an exceptionally low risk of dying. And very few, if any, children or teenagers will come to any long-term harm from COVID-19 due to solely attending school. That has to be set then against the context of the definite long-term harm from many children and young people not attending school. Data about teachers and other school staff and parents is fairly clear from the Office of National Statistics. The ONS have told us very clearly that teachers aren't at increased risk of dying from COVID-19. Obviously, that's good news any more than the general population. Teaching staff isn't a zero risk profession. No profession is zero risk, but it's a very low risk occupation, and ONS again is pretty clear on that. Transmission of COVID-19 can occur in schools, and data from UK and international studies may suggest it may be due to staff-to-staff transmission rather than pupil-to-staff, and that reinforces the need for social distancing, hand washing, good infection prevention and control. There is a risk that as schools go back in a very large way, that there's a risk on the R0 number. All of a sudden that may become important again. Schools connect households, and so it's likely that opening schools will put some upward pressure on transmission and therefore increase R. The international real-world evidence suggests that reopening of schools has not yet been followed by a resurgence of COVID-19 in a timescale that implies schools are the principal reasons for that. It's fair to say there's not been sufficient time to say that with any confidence. Opening schools may be as important in linking households indirectly through transmission beyond school. The school gate becomes important. It is possible that opening schools will provide enough upward transmission to increase R, which is why it's really important that we've got good mechanisms in place for identifying people who become symptomatic quickly, getting them tested quickly, and responding to cases and clusters quickly, and we have those in place. So all up, the consensus of evidence from national and international studies is that the risk to children and teachers is exceptionally low to very, very, very low. There is a risk that there will be transmission, and we have mechanisms in place to manage that. And we keep a very, very, very careful eye on this situation as it progresses through the autumn, and we'll keep an eye on how the evidence base changes.